dermatologist is revealing what she does to look and feel younger every day.
Joining us now again is Dr. Whitney Bowe.
All right, back with us now, Dr. Whitney Bowe, and expensive but impressive in terms of the results. But that's not the only way the neck ages. Tell us what happens.
Right, so there are three main categories when it comes to aging of the neck. So first, you have people who primarily have that fullness, and they are great candidates for Kybella. Oh.
You have to ask this question, I'm guessing.
Yeah.
Some mold.
Yeah.
I'm going to be telling you guys something you just don't want to hear. Okay, it is time to throw away your loofah, cut the cord, and never look back. I mean, from a medical standpoint, you know, it's actually considered relatively safe, especially if it's performed by a Board Certified Dermatologist or plastic surgeon. But, I mean, think about it from a financial standpoint. Yeah. You know, a 17-year-old who's looking to really commit to this throughout her lifetime, she could spend close to $100,000 just maintaining the shape of her lips. And, you know, I'm a mother, so of course I have to look at this from an emotional standpoint as well. And, you know, teens, they're sort of learning how to embrace their individuality. So I feel like if a teen approaches me, I usually say, hey, let's try some alternatives first. You know, things like cinnamon oil, menthol, you know, those ingredients deliberately irritate the lips a little bit and create a temporary and subtle.
Like
it's safe. Exactly. And, you know, from a financial standpoint, I think their parents would be very grateful that they tried that first, right?
Joining me is Board Certified Dermatologist, Dr. Whitney Bowe, who performs the procedure. How are you?
Good, thank you.
This is the actual device?
This is where the magic happens.
It is a chemical peel. So, Dr. Bowe, tell us, because this is all the rage online. Now, how do they work?
Well,
how do you apply them?
Yeah, most at-home peels are done in a series of steps. So I'm actually applying the first step right now to Karen's skin. And what this is doing is it's activating the peel, meaning that it's just starting to dissolve away the uppermost layer of dead skin cells. So what I'm doing is I'm basically painting almost a tic-tac-toe board of little baby micro wounds in the skin. So I'm making these tiny micro wounds, and I'm telling the body to heal those wounds. So the body starts to make collagen, elastic tissue.
Wow, so it naturally makes your body fix itself.
Yes.
When I drive, there's a glare. And if I was squinting, I'd be creating fine lines around the eyes. And we don't want any fine lines around the eyes. So rule of thumb, get in the car, put on the shades.
My patients have is that they're going to look different. Don't want people who are observing you to be able to put their finger on what was done. I'm marking an area called the zygomatic arch. I'm going to give you a little pinch, and this is a really beautiful area of the cheek to enhance, and it's just creating a nice lift. And that's sort of what this whole experience is going to feel like. This is Dysport, and it's purified protein that basically relaxes the muscles. So it interrupts the signal going from the nerves to the muscles so that the muscles don't contract and pull on the skin, creating wrinkles.
We're here with dermatologist Dr. Whitney Bowe, who helped in achieving their new looks. Are we ready to see them?
Yeah.
So this is what they look like before. Shelly and Carrie, come on out and join us.
With Shelly, it took about an hour. And with Carrie, I would say about 15 to 20 minutes.
You have our attention. Give us details here.